And so it goes, just when you think you have a plan and everything is moving along in order to get you to a path forward and potentially to some help, you have that phone call. And while I was expecting to go into the doctor's office and be given a full report, to get a phone call obviously is more concerning. And they were being sensitive to time and trying to give information. So the conversation shared that at least the diagnosis is made. It is low-grade B-cell lymphoma, and they are still needing to do some further assessment. He indicated that they need a PET CT scan so that they could see where in the region of the body that this has taken place, and that I could call in order to get that taken care of. So at this point, I've had her home for 2.5 weeks, and we feel like we've been making some progress. But the last 2 days, she really had become weak again, and breathing was more difficulty, and as was the coughing ongoing. And so when she coughs that much, she just doesn't get any relief. So I asked the doctor, I don't know what to do, because I've asked for the pharmacy, what can we give? No real indication, over the counter things, but check with your doctor. So I asked him specifically, what could we do for that and for the bed sore, because those are her two sources of inconvenience and discomfort. So we had the conversation about the x-ray that he had ordered from the week prior. We could go ahead and get that. If they see that the lungs are filling up, then potentially they go ahead and they get those drained. Now, I, again, am still new to all of this. So when we say do this, I'm going to go do this. When they say search this or do that or anything, I'm going to follow their direction, because I don't know any different. So I indicated to him, of course, if I can get her to go get the x-ray, we want to do that, especially if that's helpful before we come in on Thursday. Now the plan was still to say Thursday, still keep that appointment. We'll do our lab work. We'll have a consultation, make sure everybody's all on the same page, but also put her in for the start of treatment as they have it now. And he did put a disclaimer that he still has to get this approved, but he would see no reason why we couldn't get this started as early as Thursday for keeping those regular appointments. Again, my understanding was that that was going to be a 2-day treatment plan. So Thursday, Friday, she inpatient, in and out. And I'm realizing after our first doctor visit follow-up how difficult that was with the oxygen tank and making sure. So I relayed to him that we did not get the chest x-ray from the week prior because we were on limited oxygen. I know now to put multiple tanks in and make sure that we have access, but I indicated, now we know we want to do this. We want to make sure that that's not causing the discomfort for the coughing. So thank you for the phone call. Move on. Now I feel like I have at least some more information. I can update my mom and we can have a conversation and I can see how she feels. By the time I get to the house, she'd already had going on the third negative day, right? So very difficult, very congested. It sounded like she was starting to get a head cold, which I'd mentioned to her the night before, and just wanted to make sure that she was breathing appropriately through the nose and not through the mouth. But I get there, and in sharing the news and the phone call from the doctor, she just looked at me, and with that determination that I know so well in my mother, she said, well, let's just go get the x-ray. Let's just get that done. I said, okay, well, let's go. No need to wait around or do anything. She wasn't worried about getting dressed. I'm going as I am. And it's a process to get loaded into the vehicle with the wheelchair and the oxygen tank and all the stuff. So get her taken care of and head towards the hospital. And she made the comment that it'd be nice if they would just keep me. And I looked at her and I said, well, what do you mean, Mom? Why would they keep you? Like, we have a doctor's appointment on Thursday, and so we still got things to do. We're just checking on the lungs, Going to see if that's what's the problem. They can drain it. We can get you back home. Everything's great. Yeah. So we go in and I leave her in the car at the pull up main entry. And I'm like, let me just run in and see how long this is going to wait, how long the take is going to be so that we know what we're dealing with. So he was in the back and assisted stayed with her. I went running right into registration, which was closed. So it said to go on to the department where you were headed. So I went to radiology. Radiology took me right away. I asked how long the wait was because I was concerned since the last time we didn't do this because of the oxygen. And they're like, no, we should be able to get her in right away. So just come on and bring your stuff. So I bring her in, and they let me know that all they do is the x-ray. And because it's after 5, it was after 6 actually at this point. They don't know how quickly the radiologist would be able to read the x-ray. They would send the results. Doctor would probably have it then, the next day or by the Thursday appointment for sure to share with us. And I'm like, okay, but if you see that there is fluid on the lungs, we were wanting to be able to get it drained. Well, we don't drain now. What would need to happen? How do we get that drained? Well, then you would probably have to take her in through the ER. So when she comes out, of course, the assistant that was helping with that can't give us any indication on anything and can't read or tell us what was on the x-rays. And I looked at Mom and I said, so here's what I've learned. They obviously don't drain the lung. Surprise, I guess I don't put this all together, but now they don't drain it. In order for us to, if you feel that you have that pressure and you want to get this addressed while we're here, then we need to go to ER. And she says, yes, let's go. So you have enough pressure where you feel, yes, let's go. Okay, so we go to ER, and they were fantastic. Got her right away, put her into a room. I go back with her and trying to explain what was going on, why we were there, what our appointments are on Thursday. And the nursing assistant looked at me and she says, no, we're probably going to keep her. I'm like, what? Why are we going to keep her? And she's like, well, we don't just drain and do, she's looks like she's very frail. The bed sore is that's definitely needs some attention. And I'm like, well, I've been trying to get this taken care of from when she was in the hospital, give the backstory, the history, and all of this. And she's like, no, we're going to take care of her. ER doctor comes in, super nice. They have to move her around in order to try to take a look at some things. And he's like, yeah, she's staying. She's just going to stay here. And my mom looked at me and she says, it's for the best. Just let me stay here. You get some rest. And again, you go into a different mode because what you thought you had planned is now like, well, now what? And okay, if it's better for her to be here and they can do all of this. So I want to give them all the information. Like, we're trying to get a PET scan, but I was told I couldn't get that until probably the end of the month. And the doctor said that they really need that in order to know what treatment we're really going to lock in on, that they wanted to start treatment on Thursday. And so you do this brain dump of all the stuff that you're trying to juggle and get together for your family member. And they're like, it's fine. We got it. I see the notes. We'll take care of this. We're going to call for the wound care, for the bed sore, for the leaky leg. We're going to take care of getting the lungs drained, look at everything that we can do, and we'll go from there. Okay, great. So I leave because obviously I know it takes a minute or longer to go from the ER into a room. And so let them do their thing. And she was at least open to and comfortable with that. So later that evening, I called to get the room number. Okay, great. Know that I'll be going there the next day. And you just have to know that if they're getting the care that they need, if they are where they need to be, then that is the better thing for them. When the hospital stops being the place that they need because they're not getting the level of care, or there isn't anything more that can be done, then I want that care. I want to be able to give her comfort, make sure she's being attended to, and not left for 20 minutes after being requesting something, or, this is what all I have going on in my mind. But now you're back to, you're juggling not only your life and things, but your job and what you think is a schedule, and know to be, this is what we're doing, and you're working everything around that. Now you've got this new information and path, and you're like, okay, now let me step back and see what I need to do. So the next day I'm making phone calls, trying to get to the doctor. How does this affect the treatment? What's going on? And get some generalized answers, of course, talking through nurses' assistants. If she's in the hospital, they can still do the treatment. They don't think that that's going to change anything. Maybe they can get the PET scan done while she's there, and maybe that actually helps us. And so everything seemed like it's coming together for a much better, greater reason, instead of the in and out, in and out, in and out of the vehicle that we were going to be dealing with in order to accommodate this couple of days of things that we knew that we had going on. So get to the hospital yesterday after making phone calls and doing all this, check in, get the update from the nurse. They did drain her lung, and this time they took out more than what they have taken in the past. So that was definitely the pressure that she was feeling and the reason why the coughing was becoming more persistent. Now we have a couple more things to know in our own mind, what to look for, so that we can see if this is building up again and she needs to be drained. So asking all the questions, is this something where a device can be inserted and it can be drained at home? Yes, but not the best option because of the scenario. Okay, well, then we rule that out of our head. We move forward. So when we see this build up, we know we have to bring her back. Yep. And I did not catch doctor rotation. They hadn't yet come back. I talked singularly to one of the new doctors, or a new doctor on this rotation, I guess, who had just stepped aside to see how she was and what was going on. He indicated that they were going to do her treatment while she was there in the hospital, because that's their priority, is to make sure that she's getting some type of care. He seemed a little surprised that while she was there previously for the 3 weeks, and they had at least the idea of what it was, that nothing had been done. And I said, well, I mean, that's kind of was my concern. Are we wasting time when something needs to be done more? But I obviously can't make those determinations. And knowing that they're waiting on the PET scan, he's like, no, we're gonna not taken care of today. Like, we're going to get that done. I want to be able to start her treatment this evening, if at all possible. That's our goal. When we come around for our oncology group, we'll have more conversation. Great, no worries. I had one appointment that I knew that I had to keep, which was going to take me from the hospital probably right around the time that they're thinking they're going to do their round. I'm only 20 minutes from the hospital. Look, if there's any way you can give me a heads up when they hit the floor, I will come, whatever I need to do. So I had this conversation with the nurse. I want to be there when this conversation takes place with my mother, and that's my right. That's my mother's right, to have somebody there with her when this kind of information is going to be talked about as blatantly as they do in these types of room discussion scenarios. They're talking amongst doctors who know these terms, and you're there as the patient and or the family member, and you're trying to absorb everything that you can, but it is an opportunity to hear and to ask questions. So I knew that it was going to be important for me to be there. Nurse was on board, indicated, if I can, I absolutely will. In fact, let me just do a backup. I'm going to send a message to them and let them know that you want to be involved. I'm going to write it on the board to please give you a call, so that this can be facilitated. Well, her partner at that time had come in after all of this was set up. And I said to him, look, I have to go, but here's what was said, here's what we are. So when they come in, just give me a heads up and I'll head this way. Literally, I'm 20 minutes away, which he knows. No worries, no problem. I'll let you know what we got and we'll go from there. So I come to do my responsible stuff and work, and for the time that I need to be doing something else, and knowing full well that I'm going to drive back to the hospital. And when I tell you that I have adjusted and changed and shifted, and I have bit my tongue more times in ways than I would ever think possible, as would anybody who knows me think that's not possible. But I am trying to keep in focus. The purpose of what's happening is getting the care that she needs, getting the answers that we need, but also making sure that she is taken care of, that she's not in discomfort, that she's not in any kind of pain. And I get it from taking care of her for 2.5 weeks. She's not easy. It's dead weight, and you have to do all the stuff for her, and it's not pleasant. It's a definite change of dynamics as far as how you see somebody strong and independent and able to do for themselves to absolutely codependent in every way and relying on somebody for basics of living and going to the bathroom, wiping, all the stuff that we probably take for granted, never think anything about. You're doing it for somebody, and it's not always pleasant, no matter who that person is, right? So I have a new appreciation and understanding for what care is being provided to people that don't know somebody, right? But it's their job. So I go back to, if it's your job, then this is what you signed up for. You knew this is what you're going to be doing. So I do have a level of expectations when it comes to that. And it's very, very frustrating when simple things aren't being followed. If somebody is sitting in urine in their bed and the bed sheets haven't been changed because they called for a nurse for somebody to come help them so that they could get to the bathroom, and that 20 minutes passes, that to me is just not acceptable. I get there are multiple patients on the floor, but I also understand there are multiple nurses, nursing assistants, and other people with other color scrubs and everything. So there are multiple people. To me, if you don't have enough where patients can be responded to within a timely manner, 20 minutes to me seems excessive. Regardless, if you think it's not important when somebody needs to go to the bathroom, that it's okay if they lay in it, then you need to lay in it, and you need to understand how that feels, especially when you have an open bed sore, and that is your biggest form of discomfort. That is infuriating to me. It is not acceptable. I do then have to bite my tongue, and I do want to make sure that I'm addressing this with the person that it's appropriate to address it. But I go to the hospital yesterday as I received a message from her partner, and he says, the doctors were just here and I'll update you when you get here. And I am like, what do you mean the doctors were just there? Like, I'm already on my way. I could have been there 15 minutes earlier if I had gotten the heads up. So I didn't get the heads up from any of the doctor members, and nothing from the nurse, and more importantly, nothing from the family member who's not a family member. Let me take that back. From the partner in her life who does have a role, but is still not her point of contact. It is not the family member, and was explicitly indicated this was the role of the two people who will be in the room. But I'm your main point of contact. I am her daughter, and I am her POA, and I am the person who needs to have this information with her. And I didn't get it. And I was more than furious at that point, because I felt like I was not given the courtesy of being there for my mother in the moment when they're explaining exactly how extensive this disease is for her, how important it is for them to start treatment immediately, and what that treatment plan was going to be. No discussion of the prognosis or opportunity for anything.
And I just know that that was not what I wanted for her or for myself. And I was a lot upset. So going in, immediately I was greeted with the nurse. She says, I'm so sorry. I thought that they would call you. And Brian immediately steps in. He says, oh no, I told them. And they said they can't do that. If they had to call for every patient when they come in to talk, they'd never get their rounds done. And daggers shot from my eyes, I know, at that point. Like, I don't even want to hear another word. That is unacceptable. If they express that as doctors, shame on them, because it is your duty to make sure that the family is involved in this conversation, especially if it has been expressed in advance that that is required and desired. You are wrong if you said those words. The problem is, I don't know that I can trust Brian 100% on what he said. If he's relaying his own interpretation into it or what. But now I can direct my focus on him for failing to notify me, for failing to give me a heads up. Hey, the doctors are here. Can you get here sooner? They could have seen a different patient and come back. They could have done something to facilitate this. And for whatever that conversation that took place, and they continued to have in front of my mom this final diagnosis and results of a PET scan and treatment plan and everything that was discussed without my being present. Yeah, I'm more than upset, and I'm definitely pissed and frustrated. I told the nurse directly, I am not mad at you. It was not your fail. It was not your responsibility. As far as I'm concerned, you did everything that I asked, and you at least made the request. You did what you needed to do. The other failure, I will deal with that. And she said, okay. She left the room because it was very tense. And obviously, it's not the place to have the fallout, the brawl, the whatever you want to call it. And at that point, I switch it off. Like, I can totally ignore you. You do not exist. And right now, I'm going to focus in on, Mom, what did you understand? What do I need to, what's going on? How do you feel? And he ended up leaving shortly thereafter, realizing, I think, the taboo that he had made, the mistake, right, the faux pas. The nurse came back and she said, look, I feel really bad. I made a phone call. I asked if one of the doctors from the group would be willing to step back and have a conversation with you, because they really, I feel bad. And I'm like, thank you. I appreciate that. If they can, that would be fantastic. Again, it is not your fault. I appreciate you going the extra mile. And a doctor does come back. It was a little bit, but a doctor did step back and did go over, and I understand you had some questions, this and that and everything else. Mind you, I still didn't get to see the PET scan, so that's my mission today, is to get my own eyes on the PET scan. But I did have a conversation with him. He expressed how important it was to begin her treatment right then, that day, through the night, because they want to make sure that she's there, that she can be monitored, that they can care for her, and this will be better for her than sending her home and then having to come and do this treatment as an outpatient. Better for the first treatment dosage to be an inpatient and slow drip and all of this stuff. So now all of this is solidifying, okay, this is all working out. It's better for her. They're going to give her the attention that she needs. She's going to get the treatment that she needs, and everything is good. And so I'm there, and hours pass, and we have no word, no information. Is there a timeline on when they're going to start this? Well, they probably will start it with the night shift when they come in. Obviously, it's going on after 5 now, going on 6 o'clock in the evening, and so shift changes at 7. So whatever they do to switch out and everything. So, Mom, go ahead. Let's get you something to eat. And I had an hour and a half conversation with my mom. She was filled with that hope that treatment was going to be started, that something was going to be doing good. She obviously felt better because she could talk and she wasn't having the breathing difficulty or the coughing as she had had. So she sat up on the edge of the bed eating icy cups that she honestly looked like she was a little schoolgirl kicking her feet at the side of the bed and doing all the stuff. And I cherish that because that's what I want. I want those times where it's just mom and daughter sitting and having conversations and talking about this, that, and everything else. And nothing else matters. Both of us anticipating what was going to start, when it was going to start. And, then time passes and no word, no indication. Nursing staff is coming in. Has come in, not to the room, not to check on her. But we could hear them having conversations and chatting outside. And I'm going to say, the nurses station is positioned by patient rooms so that they can monitor and care for the patients. I don't know that it's appropriate for some conversations that we were overhearing, personal things going on, thoughts, comments, whatever, when you're right outside of a patient door. We're dealing with a life situation. You know that you're in that kind of an environment, and I don't really care about what that situation was going on in your off time, outside, whatever. Like, are you paying attention? One, no one came in and checked on my mom with a shift change. So there was no changing of the guard. The name had not been updated on the board as to who's the new nurse in charge. Nor had any treatment been started. So it's now after 7:30. I have no information, no idea, and treatment hasn't been started. So my mom was now tired. I positioned her, get her back into bed. I patch and put a wound cover on her leg because that's continued to leak where the sheets are wet. I move everything I can move, take care of everything, get her comfortable, and she's gonna just go to sleep. And when they need her, they'll wake her up. But when I call at 10:30 at night to do a check-in, and I'm told by the charge nurse that they did not do this treatment, the doctor failed to put in the order for the treatment itself. He'd put the order in for the pre-med, but not for the treatment. And so they didn't want to do the pre-med start of it, not knowing that the treatment was going to take place. They had called out to the doctor, had not gotten a response, so they just basically made the decision that nothing moved forward until the next day when they could address it with the doctor. And there you have it. That's how your night ends. And your next day, you're supposed to get up, start moving, get going. And again, what you thought was going to take place, that she was going to have this medicine in her throughout the night, you would go check in on her the next day, see how she's doing. Or really what ideally I wanted was that they were going to start it yesterday afternoon when it was priority. We're going to get this taken care of right away. And you were there and could be with her for a few hours of this treatment to see how she was going to respond and react. With adjustments and change, it's all fine. I understand it. But if you say that this is important and you give that glimmer of hope to the patient and their family, but then it changes for failure of doing the job, I have a problem with that. Like, there should have been a courtesy call. There should have been a, hey, we're going to get this straightened out. Or, hey, we decided that wasn't good to start her through the night. We want to start her through the day. Whatever, at least communicate it with us, because we don't know this. I've never been through this. She's never had any medical issues to this extent. We have no experience with it. You deal with it on a day-to-day. You know it backwards and forwards. We don't know the terms you're talking about. We don't understand what any of this means. And when you tell me something's urgent, then I'm freaking going to do it right then. If it's not urgent, it moves down the list. I can prioritize, but I cannot read your freaking mind, and I cannot make this up as we go. You have to be able to give me some information, and I am her spokesperson. So she can't speak for herself to the extent that needs to be done. I have to be her advocate. And if you can't address me, then we're going to have an even bigger problem. And I keep my cool so that she gets the care that she needs. But if this ultimately falls out to be your failure to do your job, then I will hold you accountable. And I think that's only fair, because if I didn't do my job, I'm held accountable. And that is only common. That should be common standard practice, because that is what you expect. Do your freaking job. Anybody who has a job is getting paid to do their job. If you fail to do your job, you shouldn't have that job. Plain and simple. I don't care who you are. I don't care what your status is. I don't care who you know. If you don't do it, then you shouldn't be there. That's simple, especially when other people are relying on you and dependent on you. If you're the expert, then do the job that you know so well. And if you can't, or if it changes, then you have to communicate that. And that is what I ask. Just communicate with me so that I can understand, so that I can comfort and care for my mother the way that needs to be done. Because now I have somebody whose hope has been dashed because she wasn't the priority she was told she was going to be. And that's my point. So speak up for your loved one. Don't back down. You do have a right to that information, and you do have a right to be there. And if they can't respect that, then they may not be the doctor or the provider that you want. Ultimately, that's what you need to do.